Hi guys, in this video I would like to share the top 5 things that doctors wish their patients knew. Hi, I'm Dr. Shaw and I'm currently a rural family medicine resident, and on this channel I share the realities of what it's like to be a resident and the experiences that I've had along the way. So let's just get right into it. Okay, so very first thing, please be on time. So the thing is that, especially if you're early on in the clinic, if you're not on time, it kind of throws off the entire clinic, and then the rest of the patients get upset because they've had to wait for long periods of time. Having said that, sometimes emergencies do come up and the patient before you may have had some sort of emergency that the doctor needs to take care of, and that's why they're running behind, or the doctor may have had some sort of emergency in their own life and that's why they're running behind. So just please be kind and, just try to be on time, and let's just do the best that we can. All right, the second thing is we're not here to judge. If you have done drugs or something that you're embarrassed about, please don't be embarrassed. I can assure you that as doctors, we have heard a lot of crazy things and we're in no position to judge. That's literally not our job. Our job is to help you, and so we would love you to help us help you. We can't help you if we don't have all the information. The only reason we ask you these things is not to make you uncomfortable or to shame you or to judge you. It's because we need to have an accurate picture of what is probably happening and how we can solve the problem in front of us to make you feel better. So tell your doctor. Number 3, we're not paid by Big Pharma to push pills and vaccines on you. There are benefits and risks to any sort of therapeutic regimen. And if your doctor is prescribing you a treatment regimen, it's the best thing to do for your health. And that's it. I think that's very important for people to know, is that, we do genuinely care and we are not paid by Big Pharma to do all this, All right. Number 4, the basis of medicine is a scientific process. Okay, so as new data, if you're not familiar with the scientific process, as new data emerges, we learn new things and we recommend new things. Okay, so that's just how the scientific process works. So we gather data and we follow the data. So if you feel that your doctor has changed up what they said earlier, it's probably because there has been new data that has emerged to suggest that the previous way of doing things was probably not the best optimized way based on the new data that was, obtained. So just be mindful of that. Things are open to change, and it's a dynamic situation and it's a dynamic field that's really data driven and based on what the data shows. So we always operate based on guidelines. So the very last thing is we're human and we try our best, and that's all. I think that says enough. And I think that sometimes it's easy to forget, but I think that's, I feel like that's what doctors wish their patients knew, is that we're human. And yeah, and with it comes a whole host of things, but you're always our first priority. But yeah, so those are the top 5 things that doctors wish their patients knew. I hope that you enjoyed this video, and see you in the next one. Bye.